Impacts all areas of life.
Recently, area experts sat down to discuss the criminal justice system and how these types of issues are preventing themselves with those behind bars and working in area facilities.
NBC5's John Hawks has more from White River Junction.
Dartmouth Health is hosting a series of webinars discussing mental health.
So the goal of this year-long series is to help change the conversation around mental health and to end the stigma that's associated with it.
A recent panel discussed the way mental health manifests through the criminal justice system. They say a lot of criminal behavior stems from childhood trauma, abuse, and neglect, even starting with kids in the foster care system.
And have a lot of trauma in their history. So we have a lot of abuse, a lot of neglect, a lot of trauma reactivity that contributes to maybe some of the behaviors that led them to be placed with us.
All the officials agree that the way our prison system is set up does not address mental health struggles.
We now utilize our prisons and our jails as mental health institutions, which we should not be doing. That's not what they were meant for. That's not what they were designed for. That's not what they were built for.
The correction system has become the number one place for treating individuals who are experiencing a mental health issue, and that is not really the environment where they should be treated.
Work is being done in New Hampshire to try to address mental health treatment outside of prison.
We need to stop utilizing the prison system as a treatment center. We should also focus our resources on individuals who require a different level of care, rehab, and community security.
Across the river in the Green Mountain State, the Department of Corrections is taking steps to help improve the mental health for inmates and prison guards, saying after the pandemic, it's more important than ever.
We have moved all of our training to become trauma-informed training and responsive to mental and emotional health needs. We're trying to roll out new programs that really address the emotional and mental health needs of those in our custody.
They try and be dynamic in responding to the needs of the newest people brought into their facilities.
We're more responsive to the needs of the individuals as they are coming in, and as those trends are changing, we are changing with them to best meet the needs of those in our care.
In Lebanon, John Hawks, NBC5 News.